ako na
So
lang.
I would like also to thank, of course, PASCOM, our partner for this endeavor, and our very own curriculum committee of APMC who assisted in this particular workshop. So all our specific objectives were achieved at the end of this workshop. Can I have my next slide, please? When we started our workshop 3 days ago, we said that we will create models, of course, syllabus, integrating primary healthcare in the respective, in our medical education program. And next, pakipindot lang, we were able to achieve the 3 specific objectives. At the start of the program, we had the global perspective as well as the national perspective on the universal healthcare. Next slide, please. And as we all know, as of April of 2022, there are about 43 countries around the world who are very much into universal application or implementation of universal healthcare in the different aspects of their financial status or financial level. Next slide, please. And we are very thankful to our first speaker, Dr. Reid, our former president of APMC, who gave us the perspective in terms of the global perspective of primary healthcare and is actually focusing on the refocusing of healthcare system on on primary healthcare for us to be able to provide quality care for all Filipino people. Next slide. And he is referring actually to this message from WHO report of 2008, where the very important aspect of primary health care will include mobilization of forces in society, agenda of transformation of the health system that is driven by social values of equity, solidarity, and participation. And if you have heard or if you remember the lecture of Dr. Derry, the most there are institutions or even countries around the world who were very successful in the implementation of the primary healthcare, considering or putting into the concepts of what is being mentioned here. And this has been from the WHO report of 2008. Next slide, please. So again, the Universal Healthcare Trust consists of 3 strategies. And this is what is written down in the Universal Healthcare Law as well as in the IRR. And the strategies that has been discussed also in our workshop includes the following: the financial risk protection through expansion in enrollment and benefit delivery of the National Health Insurance Program. Number 2 is the improved access to quality hospitals and healthcare facilities, and this being emphasized as one of the thrust of the Universal Healthcare Law, and the attainment of our Millennial Development Goals or the Sustainable Development Goals, which is very important. That's why most countries are now implementing UHC and should also be the trust of the country. Next slide, please. So over the last 3 days, half 3 days, we were talking about CHED outcomes for the College of Medicine, program outcomes for the Doctor of Medicine program. And as we went through the workshop, you were able to evaluate that this is actually can easily be aligned with the 6 pillars of PHC physicians. And this is what we worked on in the workshops and the breakout groups and what was initially presented to us by the 12 groups or 9 groups during our plenary sessions a while ago. And as you can see in this slide, you will note that these 6 pillars are actually, it's not far from what the CHED requires us to do in terms of the program outcomes for the Doctor of Medicine. Next slide. And if we go further and looking into the primary healthcare competencies mentioned by the UHC law, it is actually still aligned with the CHED 10 learning outcomes. So it means to say that when we construct our instructional design or maybe our curriculum in the future, in the near future, reorient it, it's not going to be very difficult for us. And it is shown in the way we participated in all the breakout sessions that we had conducted. Next slide, please. And because of this, where are we now? Where do we go from here? So after this workshop, which is a very productive workshop, we are going to move towards reintegration of the primary care for basic medical education. What we already had was at APMC working with PASCOM, and working with PASCOM in this particular workshop for us to come up with ideas with several models of our core syllabi for primary healthcare. Later on, there's a need for us to coordinate, collaborate with other specialties like PAFP, with specialty societies who will also be helping us so that we can integrate primary healthcare in the primary health services of clinical medicine, internal medicine, pediatrics, surgery, and even obstetrics and gynecology. And eventually, what Dean Osqueta has been mentioning always in the last 3 days is the integration of this in our basic sciences through our associations of the basic sciences. So all of these need to be put together so that we will be able to reintegrate, reorient our curriculum to fit the primary healthcare law, and for us to be able to deliver and reintegrate primary healthcare in the basic medical education. This in collaboration with agencies like CHED, DOH, and PRC. And that is what we will be doing in the next few months. Next slide, please. So we were shown the timeline for its implementation. And with this timeline, there's really a need for us to look into our curriculum again and really come up with something. Though we were saying that the curriculum of each medical school, you have academic freedom to devise your own and to reorient and reintegrate primary healthcare in your own curriculum, depending on what the institution wants or the medical school wants. But with this timeline of implementation, we are already on the reorientation of the healthcare profession education curricula. So what I was thinking of is this. Next slide, please. That our roadmap will be like this. So after this particular workshop, we have already designed, or you have already designed, some of the course syllabi, which will serve as a model for us to create our own course syllabi and eventually our primary healthcare curriculum. Next slide. Pakipindot. Yeah. Okay, so we are planning to create a technical working group so that your outputs will be included to come up with at least one final syllabus that will serve as a minimum standard. The minimum standard that we can prescribe, or we are not going to completely prescribe, but a minimum standard that will help as a basis for medical school to use for their particular curriculum. They can institute anything that they would want, depending on the mission vision of the institution, depending on the curricula that they are following, whether it's a problem-based, whether you're using OB or you are using a competency-based, you can still use it. So therefore, the technical working group will utilize the output of this workshop for us to come up with a primary healthcare course syllabus that will serve as the minimum standard, and that APMC will try to come up with that. And eventually, the institutions can now develop their own curriculum based on the syllabus, based on the requirements of that particular syllabus. And with this, what will follow will be our faculty development programs as we develop our own curriculum and as we promote this curriculum, where we are now reintegrating primary healthcare in the medical education program, in the basic medical education program. And because of the timeline that was given to us by DOH regarding the reorientation, which is about a year, I think it is also necessary that our own curriculum will be now also in place in 12 months. Maybe before the end of 2022 or before the end of 2023, we will be able to show that it is evident in our curriculum that primary healthcare is already reintegrated or reoriented. Next slide, please. So again, I would like to say that what our country needs are really doctors who are going to be taking care of our patients, not only in the hospital, but there should be a continuity of care. Because the government mandates aiming to ensure that every Filipino shall receive an affordable quality health benefits. And this involves adequate resources with like health human resources, the doctors, the health facilities, the primary care facilities, and health financing, which will be PhilHealth, who will finance all the health services. So at this point, I'd like to say thank you very much to the organizers, members of and officers of PASCOM, as well as the APMC Curriculum Committee, to our 134 participants who attended this workshop. Our journey towards reintegrating primary health care in the basic medical education starts today. And so we look forward to the engagement, active engagement of our 58 medical schools and 81 postgraduate interns hospital. So thank you very much to everyone. And I hope that we will be seeing more of your faculty in the next faculty development programs related with the reorientation or reintegration of primary healthcare. Thank you very much, and God bless to everyone.